Hi, my name is Monica Hall. I'm currently working at Green Cross Vets KennelCough, and I've got student number 3785-76695, and I'm just talking about the basic care of dogs. This is my practical, and I'm talking about kennel cough, the disease. So describe the disease. It has a few causes, most common being a bacterium called Bordetella bronchoseptica, which kennel cough often gets called Bordetella. The disease is spread when they inhale the bacteria or the virus particles into their respiratory tract. The tract is normally lined with a coating of mucus that traps the infectious particles. It can be caused by crowded or poorly ventilated conditions, such as in kennels and shelters, cold temperatures, exposure to dust, cigarette smoke, or it could be stress as well, induced from travelling, something like that. The disease can be prevented, keeping your dog in a well-humidified area. Make sure it's vaccinated against the kennel cough and not being in contact with a dog that's suspected of having kennel cough. Signs and symptoms is generally a persistent cough, distinct cough. Other signs can be sneezing, runny nose, maybe eye discharge, and they might lose their appetite or have a sort of decreased energy level as well. Actions would need to be taken for the animal affected. If there was an outbreak at the clinic, we need to keep away from all other animals, put into isolation ward where it would be given the barrier nursing. A note placed on the door, separate equipment, food bowls used and then kept beside the room. A large water bath, disinfectant for soaking, washing items. The food bath at the door for entering, and then obviously for leaving as well. PPE has to be used, and also have a bin beside for putting anything that is to be disposed of into the bin. Describe, demonstrate treatment methods. Dog needs to be checked out immediately, isolated from all other animals, has good hygiene care, antibiotics, which are sometimes given, and also not taken for walks and obviously socialise with other dogs, kept away from everybody. Describe, demonstrate patient accommodation in the isolation area. So you'd have a suitable structure where you can carry this out. Bedding, you'd need ventilation, and the temperature all needs to be, kept at a reasonable, suitable level. Accommodation should have a large crate or cage which is easily cleaned and can be disinfected out. Disposable bedding, so that can just be thrown away, and it's comfortable for them to lie on also. Food and water should be available, good ventilation, and obviously the temperature has to be maintained as well. Describe and demonstrate equipment kept in the isolation ward. So we'd have the PPE, monitoring equipment, how it's stored and maintained. So we'd have a table outside the room, which is set up with all your equipment, PPE, gloves, gowns, hats, masks, booties, everything that you're going to be wearing to go into the room. You would need to be in the room. You'd have the stethoscope, thermometer, clean mats, disposable bedding. You'd have your waste bin. You'd also have, obviously food and water would be there. You would also have to have maybe paper towels, needles, syringes, bandages if you were needed, mop bucket, disinfectant, everything, scissors, and a sharps bin. So you need to have everything there. And describe, demonstrate OHS and PPE requirements. So you need to wear the full PPE, wash hands thoroughly beforehand, placing feet in a foot bath, then wearing your gloves, masks, hat, gown, booties before entering. All waste bin disposed of in a waste bin in the room. PPE should be disposed of in a waste bin beside the room. Feet soaked again in the foot bath, bowls, equipment soaked for a while and then washed and left to dry. Describe and demonstrate food preparation. All the food and water should be kept in the room that's being used. Follow the correct procedure for entering and prepare the food on the table in the isolation room. Then when that's finished, you can soak any equipment that needs to be washed. So soak it first, then give it a wash through and the water and the disinfectant, and then it's left to dry. So describe and demonstrate daily cleaning. So step-by-step instructions. You wash your hands thoroughly, soak feet in the foot bath, wear PPE, enter the room, fill a bucket with disinfectant and water for cleaning the cage, another bucket and a mop for the floor. Remove the dog from the cage using a lead. If there's not another spare cage for the dog to go into, then you could just tie the dog up beside the cage with the slip lead. Remove the dirty bowls and soak them. Dispose of all the dirty bedding and any other waste that needs to go to be removed, and put that all into the waste bin. Clean the cage thoroughly, and the doors and ceiling, sides, the floor of everything. Let that dry, make up the new bedding, you've got fresh food to make up, nice clean fresh water, and place that all in the cage ready, and then you could put the dog back into the cage. Wipe down all the surfaces with Trigene and a disposable cloth, including your light switch, around your door and the frames. Mop the floor thoroughly, dispose of the dirty water into the sink and in the room, and then clean the sinks thoroughly as well with the disinfectant. Any waste must be tied up into the bin bags and then sealed up and then placed into the big bin for incineration or disposal in the appropriate bin that you have. When leaving, dispose of all PPE in the bin and use the foot bath again and wash hands thoroughly. So demonstrate waste disposal. Any waste must be tied up in bin bags, placed into a bin for incineration or into the disposable bin that we have at the clinic. Describe and demonstrate cleaning of the unit on patient discharge. So after the patient is discharged, the room must be cleaned thoroughly everywhere. So wearing the appropriate PPE, you carry out your cleaning again of the cage, you soak all the equipment, dishes, bowls, everything that's been in there and been used in the water and disinfectant, and that's left to soak for the required time and then washed and dried. Spray and wash down all of the room with the disinfectant and then leave that to soak and just leave it for the rest of the day, and then you could go back in and repeat that again the next day and then wipe and wash down, which is what we've just had recently in the clinic. There was a dog that was in one of the treatment rooms, had come in to see the vet, and we had to obviously clean the whole room thoroughly, spray it and leave it for the rest of the day and overnight, and seal the door off, put a note up that we couldn't go in because the dog had suspected kennel cough. Describe, demonstrate records which must be maintained. So all records must be kept up to date. Patient records must have all information in them regarding the dog's vitals, medication, the demeanour, eating, whether they're drinking, whether they're urinating, defecating, along with the dates and times. Cage cards should also have all the relevant information on it about the dog, so that obviously the vets and nurses are all kept up to date with everything that's going on. The treatment board should also have the relevant information on while the dog is in isolation, noting down that it is in isolation and why it's there, what medications, if any, has been given, or what treatments, what time it's been fed, times of vitals was done, heart rate, respiratory rate, all the usual vitals. And any other treatments or medications that has to be given, and at what time they need to be given as well. So that all needs to be recorded down. Okay, thank you.